Hello, everybody. My name is Brooke Hassler. I am a pediatric occupational therapist with Hillmann Pediatric Therapy. And today I wanted to go over how to identify and support your child who may be having some sensory difficulties. So let's get started. All right, so occupational therapy can occur in a variety of settings with various age groups. OT can help children reach their goals and developmental milestones that improve their daily lives. We teach them to adapt to sensory differences, improve their play skills, become more independent with self-help care, feeding routines. We also work on fine motor and visual motor skills to help with writing, scissor skills, and manipulating clothing fasteners. At Hillmann Pediatric Therapy, we do see children as young as a few months old, all the way up to 18 years old. We do have a couple different types of settings that we work in. We have a outpatient clinic, one in Shorewood and one in Sycamore, and then we also go into some of the schools. And OT in the different settings can look very different. So OT in the clinic, we are going to be working on some fine motor skills to help them improve their fine motor skills, such as grasping, using scissors, writing, manipulating small objects. We can also work on some gross motor skills to address coordination, balance, strength, and endurance. A lot of times we do like to do movement activities to help regulate our children that we see, which we will go over in a minute as well. And sensory processing. This is a huge one that we work on with sensory regulation as well as emotional regulation. And we're going to get into why that is so important. We can also help with activities of daily living, such as dressing, feeding, and some grooming skills. We also work on social skills. The clinic is a great place to do this because there are other children in the facility also coming to work on some of those social skills, whether it be with speech, with OT, or with PT. So doing some of those social interactions as well. And then we are going to provide you, the parents, with some education and some support as well. Now, in the school, all of the therapy has to be academic based. So we can work on some of the same things, but it all has to be related to their academic skills and where they're having a hard time with their academics. So working again on some writing skills, cutting, holding different classroom materials, managing and organizing their stuff, some self-care, and then that sensory regulation piece in the classroom as well. So overall, the goal of occupational therapy is to really support children develop the skills they need to participate fully in everyday activities and reach their fullest potentials. And we help provide specific interventions to make that possible. All right, so let's dive in. What is sensory processing? So sensory processing is how the brain receives information from all of our senses. That information is then processed, interpreted, organized, and then prioritized to develop a plan for a response, and then our bodies will react to that response. These are all of our different sensory channels. So typically you might know those top 5. So vision, hearing, taste, smell, and touch. We do also have 2 hidden senses, our vestibular system. So that is going to be how our body responds to movement and changes in our head position. It's going to help with balance and our sense of movement. So sometimes when you feel like you're moving in a car, but you're not, but the car next to you has, that's part of our vestibular system. Which is also super important for bilateral coordination, balance, and our spatial skills. Then you have our proprioceptive system. So that is really knowing where you are in space. It's going to take information from our tendons, muscles, joints regarding our body's position. It's also going to help us determine how hard of an impact or soft of an impact we need to make on something to make something work. How fast or slow to go, and helps build more coordinated motor skills. A good example of knowing where your body is in space is like when you're going up and down stairs, you're not necessarily focused on every single step. You just know where your body is in space. And when you walk through a door, you know where to put your body so you're not bumping into that door. So that is all of your proprioceptive system. All right, this is the process of sensory integration. This is how our bodies process sensory information. So the first level is how our brain is going to gather that information from all of those senses we just talked about. Then our body is going to respond with that information and start to develop a plan on how to react and get to that end product. So if our bodies are having a hard time to know what to do with the sensory input, we or our child might be having difficulty with how to regulate themselves. They might be having a difficult time with motor output or difficulty perceiving the sensory input that they're getting. So let's go over each one of these and what it might look like for your child. So sensory modulation involves adjustment of neural messages that convey information about sensory stimuli. So a well-modulated person is going to be able to notice relevant stimuli and filter out that unimportant stimuli. So for example, when your air conditioner or heat kicks on, we are mostly able to kind of filter that out and still focus on what needs to get done. Where some of our kiddos might hear that turn on and be very distracted, like, what's that? What is that? What does that mean? Instead of focusing on what we're asking them. So that would be an example of having a hard time with that sensory modulation piece. Um, let's see. Next. So this is sensory modulation kind of continued. So we can have either a low or high threshold for sensory modulation. If we have a lower sensory threshold, we might be over responsive to that input. So a small amount of sensory input is going to set off a larger response. Where a high threshold, you can be under responsive to the sensory stimuli or actively seek out more of that stimuli. And oftentimes with these kiddos, a larger amount of sensory input is needed for the brain to use that information. All right, so now I want to look at specifically an over-responsive child. They're going to have a very low threshold for sensory input. So something that may seem very small to us, they're going to have a very large reaction. They might demonstrate a negative or avoiding response or be defensive or avoid and try to get away from that stimuli. So for kids that are having this over-responsive response, calming activities are going to be very beneficial to help them regulate. Next, we have the under-responsive child. So they are going to have a very high threshold for input and oftentimes more seem like a bump on the log or just super chill that nothing seems to bother them. They're going to need additional sensory input in order for them to meet that threshold to be able to attend and learn. So we're going to want to do more alerting activities for these kids. Next, the sensory seekers. I'm sure if you have a sensory seeker, you know they're constantly on the go trying to seek out more and more of that input. So they have a very high threshold for sensory input. So they are going to benefit from highly structured sensory motor input for them. All right, next up we have sensory motor integration. So sensory motor integration involves the process of receiving sensory messages and producing a response or that motor output. We receive the information from our bodies and the environment throughout those senses that we talked about earlier. And the sensory information is then processed efficiently and can produce an appropriate motor or movement response. Now, our kids who have a hard time with sensory motor integration are going to seem more clumsy. They might have a hard time producing those motor movements. So that's when we know that they are having a harder time with the sensory motor integration piece. Next, we have sensory discrimination. This allows us to recognize the details within sensory input and between different sensations. So smell, touch, vision, hearing, vestibular and proprioceptive input. So for example, if a kiddo is having a hard time with discriminating proprioceptive input, they might be the kid who is super rough all of the time during their play or have a really hard time knowing how much force to use, whether that be in play or whether it be throwing a ball, different things like that. They're having a hard time with their proprioceptive input. Can also be with any of those other senses as well. Okay, so it is super, super important to remember we all react to and avoid sensory input differently. So think about your personal preference. When you are trying to focus on this presentation, for example, are you, moving your hands a lot or bouncing your knee up and down, clicking a pen, playing with a hair tie, different things like that we have learned to help us cope to attend to different things that we need to throughout our daily lives. A lot of times our kids just don't have that. So we need to teach them the strategies to do that. Or also think about what type of environment that you like to work in. Do you like the lights dim? Do you like the lights very bright? Do you like to have background noise? Do you like it to be completely silent? All of those are ways that we have found help attend to a task. So we are all very different, and we need to keep that in mind with our kids as well. Every kid is very different, and they could, differentiate from day to day as well. So for our kids with sensory deficits, we need to best support their individual sensory needs in an optimal way in various environments in order for them to participate, play, pay attention, and learn. And let's see. So now we're going to get into the specific strategies for each type of sensory input. All right, if you remember anything from this presentation today, please remember that movement is crucial for our child every single day. Some movement is going to be more alerting and some is going to be more calming for your child. So figuring out what type of sensory intervention they need, that's where we come in as occupational therapists to help you figure out which best strategies are going to work for you and your child and how to set up your home to be successful. All right, so as I said, movement is very critical throughout any child's day. Jumping, climbing, dancing, bouncing or rolling over a yoga ball are all very good vestibular movement activities. But again, keeping in mind that sometimes this could be alerting for your kids, sometimes this could be helpful to help calm them. So again, we would love to help you figure out which type of strategies are going to work for you. These are some more additional movement strategies we can use. So allowing different position changes while they're working on a task, standing next to the table, kneeling, laying on their belly is actually a really good strategy. It can be very calming for some kids while they're working on some paper pencil tasks, working on a vertical surface. Doing some different jobs for you. So, hey, can you go grab me that from this room and bring it back to me? If you go to the park, doing some different playground challenges, exercise movement breaks. They have a ton of different fun like yoga out there that are videos. I really like on Amazon. I've gotten they're called Yoga Gorilla cards. So it's a gorilla doing different yoga poses. Kids love that. Super fun, super calming. Providing them something to sit on so they can kind of move around while they're trying to focus. Scooters, ride on toys, and trampoline are all really great movement strategies as well. Next up, we have our proprioception strategies. So again, we're trying to activate those receptors in our joints, muscles, and tendons by pushing, pulling, or lifting. So a lot of heavy work is going to be super helpful to kind of figure out where their body is in space, whether that be filling up a laundry basket with some of their favorite toys and pushing that around the room, or pulling it is a great heavy work activity. Have them help you with the laundry, bring that laundry basket for you. We can do weighted or compression items, but I highly recommend you talk to one of the occupational therapists at Hillmann, or if you are watching this, talk to an OT for specific guidelines, because there are very specific guidelines for wearing compression items as well as using weighted items. So keep your child safe and yourself safe as well. Here are some visual strategies for calming or organizing. So children may need a decrease in their visual stimuli in order to attend. So using separate, less cluttered workspace. I don't know about you, but if my house is a mess and I'm trying to get work done, I cannot do it. I need a clean space, usually facing a wall instead of a window, to help kind of keep my attention and focus on what I need to get done. You can use different lights to kind of either brighten or reduce some of the lights, opening or closing your blinds. You can allow them to wear a hat, decrease the visual busyness on their paper. So if it's a ton of words, that's going to be really hard. So taking maybe a blank piece of paper and covering up that bottom piece of paper for them so they're only focused on one chunk at a time. Give them some eye breaks. You can use visuals to help organize their day and their schedule so they know what's coming next. And finding like a nice calm down area where they can go to kind of decompress a little bit. There's not a ton of stuff around, and just decrease that visual output. Next, we have auditory strategies. Again, some of these calming strategies, earplugs or noise canceling headphones allow for that quiet workspace for them. If they prefer to have music, you could have some quiet background music that replicates a resting heart rate, or more alerting music with an increased rate and volume. So those are some examples there. Taste. If your child is seeking a lot of oral motor input, like wants to constantly like chew on their lips, or chews on their pencils, these are some strategies that can help them. Mints or gum, again, if they're going to be safe with that and appropriate age to provide them with mints and gum. Sugar-free gum is more dense, so it's going to give them a little bit more input, or allowing them to have chewier, crunchy snacks is another good way to get them that oral input. They do have chewy pencil toppers or jewelry little necklaces that you can have them wear to chew on instead of chewing on something that's not as appropriate. There's also some deep breathing iPad apps out there. And again, as always, be cautious with allergies whenever you're doing something with taste. Next, we have touch. So if your child is very amped up and you want to try to calm them down, soothing touch is going to be that more slow, continuous, steady, prolonged, and rhythmic pressure. Providing deep pressure to their arms, their hands, and their shoulders are really good. Or you could even do like a beanbag on their lap, or have them lay on their belly and give them some different input with a beanbag or a peanut ball as well. Exciting touch is going to be fast, intermittent, vibratory input, and really light touch. Hand fidgets are also great. Again, if they need something to kind of play with. Again, think of you, if you need something to kind of play with while you're talking or doing a presentation, that is kind of going to stimulate that, but also making sure that they're being appropriate with those fidgets and not using it as more of a distraction, but as a tool. Some olfactory strategies. They do make scented bracelets, inhalers. I really like to use scented bubbles during my therapy sessions, especially if a kid is having a really hard time regulating. It's a great way to get in deep breathing without them realizing they're working on deep breathing. So having them smell the bubbles and then blow the bubbles is really good. You can also use some candles. And then I have listed some calming scents would be like lavender, jasmine, rose. Alerting scents are going to be more of those like citrusy, pine or rosemary, bigger smells. All right, so now putting all of that together, try to allow for a choice if possible. Don't give them too many choices. 2 or 3 is usually good. I would not go over 3 choices, especially if your kid is having a very hard time, having too many choices and too much language thrown at them. They're going to have a hard time processing and they're just going to continue shutting down. So giving them, do you want to jump on the trampoline or get squished in the crash pad? And then leaving it at that and seeing if they can make the choice. If your kid has a hard time processing auditory information, giving them visual choices has been also super helpful. And having a calm down corner somewhere in your house where they know if they are having a hard time, they can go and calm down quietly and kind of decompress. And then also having some alerting options in your house where they can really alert themselves if they need to. All right, so we also have a Facebook and Instagram page, as well as our YouTube page, which you're probably watching this video on. If you take your phone and hover over the QR code, it is going to take you directly to our links. Please give us a follow for some additional information. We like to post some fun activities for you guys to do to work on various fine motor skills. There's also some PT and speech things in there as well. Here are some other great resources that we like to use. Definitely follow us on our Hillmann Pediatric Therapy website. The SPD University has some good online video lectures more about sensory processing. I've listed some books and then some games. So like I said, the Yogarilla cards I really like to use. This is another game that I got. It's called Emotional Roller Coaster. It is a board game that works on various calm down strategies, different emotions, and it's almost like Chutes and Ladders, so it's really fun. And then there is a YouTube video that I really like to use too as more of a visual to work on some of that deep breathing. It's a pufferfish breathing video. So the pufferfish will get bigger as you're supposed to breathe in, and then it will get smaller when you're supposed to breathe out. So that is a super nice, relaxing video to use as well. All right, so if you are having a hard time figuring out your child's sensory needs, we would love to help you at Hillmann Pediatric Therapy. So please contact us. I listed both of our locations, our Shorewood location as well as our Sycamore location. You can give us a call and see if OT is the right fit for you. You can also email us. And thank you so much for your time and for watching this video. And please let us know if you have any questions. We look forward to talking with you.